Dr. Soopramanien. Okay. Welcome. Presenting us a speech on how digital health can improve care in spinal cord injury.
First of all, I'd like to thank the organizers and Dr. Turnin for inviting me. It's a real privilege to be here. And after listening to everything that has been presented today, for example, in Philippines, in India, and all the wonderful talks, for example, from speech and language therapy. So I was wondering whether I could contribute anything more. But I'll just explain to you that what has been my journey. In 2003, I was a consultant in spinal cord injury in Salisbury in the UK. I realized then that we had a huge catchment area of 11 million population for only 42 beds. And so means that we could not get a lot of patients through the door on a regular basis. So what the next thing is that some of the patients stayed a long time for their rehabilitation because they were kept in bed artificially because of the high level of incidence of pressure ulcers when they were coming to us, in spite of coming from very reputed hospital trauma centers in the UK. So, which was a bit of a shame, but this is reality. And other complications were that they had huge complications with the bladder, their bowels, their skin. So this led us then to make a film to explain to the sort of acute hospitals how to deal with a patient with spinal cord injury. So we were unable on a regular basis. In the UK, there's a motto that once you are a patient on a spinal unit, you're there for life. So it's injury to grave motto. So you are followed up every year, and you have got sort of yearly follow-up with ultrasound, abdominal X-ray, and also clinical examination. The other thing that I identified then was that patients were very isolated, and the family was struggling because it was a catastrophic injury for many of them. So I'll explain to you that in 2003, I participated in a multi-center research group study, which was led by, in fact, the Italians. And the coordinator was somebody called Marco D'Angelantonio, who is from HIM. And one of the leaders was the telemedicine Rizzoli. And my unit participated with Montecatone in Italy and CTR, Centre de Rééducation de Brussels. So, and we did some fantastic work, and it was a great team. We published our first ever randomized controlled trial on telemedicine for spinal cord injury. We published it in the Archives of Physical Medicine and Rehabilitation. Then the question that was asked always, yes, my colleagues would tell me that this is not real science, because our unit was involved in a lot of high-profile research on implanting the electrodes in the lumbar spine and looking at cure spinal cord injury. I felt that whilst we were waiting for the cure, we needed to care. And so people were asking us, do you think that patients will accept telemedicine? So we commissioned a research with 2 professors from University of Bournemouth, and I'll show you a little bit about the results. I'll speak very briefly, because in 10 minutes I will not be able to go through all the work that we've done over the years. So then we said we needed to do more, because we only had qualitative studies only on a very small numbers. We had 6. That was enough for the qualitative study. But again, we were questioned on the small numbers. So we asked one of our patients, who was a high-level tetraplegic, to do a face-to-face long questionnaire. So she did it on 15 patients. and the interview lasted about 1.5 hours, to ask patients and families what they wanted of telemedicine and what we would use telemedicine for, and they designed for telemedicine. We said 15, 6, maybe that's not enough, so let's do an online survey with using SurveyMonkey. The first one we did, we had only had 22 responses. We said that's not good enough, so we did a second survey of SurveyMonkey, where we interviewed patients, relatives on the one hand, and carers, and on the other hand, we had healthcare professionals, and there we had a very good response, where about 200, the response rate for both groups was in excess of 60%, around 60%. So 228 responses from patients and 88 from healthcare professional. And the last one was, interestingly, I know that the last presentation was about the PACE project. I was involved in the PEACE project, which is the last one was sort of availability of technology everywhere. So this is just a quick word about the work that we did in Thrive. So the main author has been Laura Dall'Olio from Bologna University, and the rest of us were participating, and we are all, of course, active authors to this publication, which is the Functional and Clinical Outcomes of Telemedicine in Patients with Spinal Cord Injury. And we had 137 patients. Half of these were having the telemedicine group. The others were not having telemedicine. We had weekly sessions with either doctors and nurses on one hand, or OT and physio on the other hand. We had a lot of information from this study. For example, there was no change in the complication rates between the different groups, but there was functional improvement in Italy, and we knew why afterwards, is because the length of stay was much, much shorter in Italy than in elsewhere. So that's obviously when patients are discharged after 6 weeks, 7 weeks, or even 2 months, they had potential to be able to improve quite a lot, whereas our patients would stay about 6 months. And people valued the input, and there was improved mood with carers and families. I invite you to read our article if this is of any interest to you, because it's quite interesting. Then we did a telemedicine. This is the other topic I mentioned, qualitative study. I've not yet published, but this is the two, we had the University of Bournemouth involvement there. So we had interview with the 2 health professionals plus 6 patients, and we reviewed them after some time to see whether they were happy. And the information we gathered was that it was extremely positive. People liked this input quite a lot. So we did, as I said, long interviews, 15 patients, then 22, then 228 and 88. And this is, again, we're going to publish this because we've got a lot of statistical data on what we found. So we've got a lot of these graphics, but for the sake of time, I've got only 10 minutes. I cannot go give sort of credit to this lovely work that was done with regard to the SurveyMonkey. And the information we got from this SurveyMonkey in general is that the device needs to be tailored to the needs of each individual. Patients wanted entertainment functions to be incorporated, and equipment had to be discrete, and in some cases, wearable. So there was great value in video and audio communications, and they wanted a system that would enable them to take pictures and videos to send to healthcare professionals, and they wanted touch screens as well. So, and the PEACE project, it's an acronym, and it's about, we were testing a device so as to be able to monitor what was said earlier, to monitor patients at home. So we had a device, and if you're interested, you can watch the film that I've produced on this. It's on my website. on telerehabilitation. So there is a film that we've made on this, and it explains to you, you will see there, this device in which there is not a cat, but there is a sort of computer voice asking people whether they were fine, whether they had been well. But we had to adapt this to the population we were serving in the UK, because and the feedback we got from patients, because at times people felt that we were not appropriate in the way we were asking the questions, so we had to adapt all this. And then to allow patients, to allow better care and less incidence of complications in the acute phase, we did a film which again is available on my own website. It's on the sort of acute care. I promise you I'm not doing any publicity for my website, but it so happened that the videos are hosted there. And the lessons learned is that telemedicine can provide instant access to specialist advice. The encryption and confidentiality that we are able to offer allows us to be able to break to be compliant with the laws of GDPR, which is something we are hot on in the UK with these days. We're trying to empower patients, so it's not just the doctors or the nurses telling patients what to do. They tell us at times what to do, because the management of spinal cord injury is so complex that at times we get the patient to become specialists themselves, so they teach their GPs how to treat them. And the quality of life of patient and relative has been increased. Mentioning as well about the carbon footprint. At times I had patients, I was sitting in my clinic, would travel all the way to Salisbury from Devon and Cornwall, spent about 3 hours each way to come and see me. And I said, how are you doing? I'm fine. And you've had your ultrasound, abdominal x-ray, everything looks fine. Do you have any problem to discuss with you? No, everything is absolutely fine. Was this not a waste of time? At times I've been signing for £600 for people to come in an ambulance, to come and see me to have this result. I thought that was a waste of resources. And also we use the technology to be able to educate our staff, and also we do a lot of teaching because we're a regional unit, and so we've got a lot of hospitals around us that would benefit from our teaching. So we teach remotely using a lot of sort of videos that are available. At times, we don't reinvent the wheel. If we find a very good video that is available in another country, we use it, especially if it is available online. So, in future...
Excuse me, only 1 minute left.
No problem. In future, the lessons learned can be applied to other pathologies or conditions, for example, stroke, brain injury, MS, etc. Earlier discharge or discharge with support telemedicine. We can look at monitoring of vital signs for patients who are very sick. And in short, what we're looking at is support at different stages of the journey of the patient. Thank you very much.
Thank you very much. Sorry, but the schedule is very tight. So is there any question? Only one? Over there?
Hello. Sorry to be such a pest. Quick question. So if I understand correctly, you do video visit, am I correct?
Sorry?
If I understand you correctly, you do video visit, correct?
Video?
Video visit.
Yes.
Okay.
Yes, so video consultation, yes.
Video consultation, okay. Well, we do annual physical too. So the question I have hard time because I cannot justify billing because I cannot do an Asia exam. And how can you do it if the patient is in the home?
In the Asia?
Right.
I mean, that's part of things that, bearing in mind that this study that we did was done in 2003, but nowadays technology has moved on such that we are able to do, one of the training. We can do either two things. We can train people locally, clinicians locally, like physios, OTs, etc., to do it so that we can have remote virtual clinics, or otherwise, because the VESHA will have to be done by a clinician, somebody who's trained. So we can do the training as part of what I was saying earlier. We train people so as to do it locally, and we've done that already. So it should not be very difficult to do that. But the technology now will allow us to get very good quality sort of feedback from them remotely.
Okay, thank you so much.